Vanessa Roman. I am the cardiology research technician.
Hi, I'm Kursten. I'm an assistant professor of cardiology here at NC State. I did my residency training at Tufts University in Massachusetts. I went into private practice for a few years and then did an interventional cardiology fellowship at Colorado State University, and now I'm here. This is our brand new cardiac catheterization lab. It's been up and running for the past 3 weeks. So this is something that's called a C-arm and a fluoroscopy unit. It allows us to perform minimally invasive fluoroscopically guided cardiac procedures. So we're using radiation to be able to visualize the heart, kind of up on the screen here, to help guide our catheters and guide wires to perform those minimally invasive cardiac procedures. Yeah, most of the research that I'm interested or focusing on at this time involves radiation dose and exposure to our patients, to the operator, and to our staff. And some of the great things about this new cardiac cath lab is the extra kind of shielding to protect us from ionizing radiation, which comes from the C-arm here. So ionizing radiation can increase our risk of forming cataracts and developing cancer. So really important that we protect ourselves during these procedures with these extra shielding. We usually wear a lead gown as well as a thyroid shield, and we monitor our radiation dose with dosimetry badges. So one of the things we're interested in is kind of as an operator and personnel, how much radiation dose are we getting exposed to when we enter the room for specific cardiac procedures? One way to help with radiation dose and awareness is using real-time dosimetry. And so this is what those badges look like. So during the procedure, every time we step on our fluoroscopy pedal and we're using this C-arm, our dose of radiation will come up on this screen here, and it alerts us if we're getting too much radiation at one time. So that allows us to be more aware and develop better radiation exposure and safety protocols. Other things that we're interested in or that we're looking at is something called pulmonary valve stenosis. And so that's the valve that's between the right side of the heart going to the lungs. And so when that valve is stenotic or can't open, we perform a procedure called a balloon pulmonary valvuloplasty, and we help to open up that valve. There are cases where that valve will restenose or fibrose, and so we're looking at the rate of restenosis in those patients that have undergone a balloon valvuloplasty for pulmonary valve stenosis, as well as trying to determine any risk factors for patients that might develop that restenosis. Other areas of interest are looking at kind of having to do with our interventional procedures, but focusing on vascular access. So how we get into the blood vessels in the heart of our patients as we perform these procedures, and looking at some techniques to enter the blood vessel as well as to appropriately close the blood vessel to prevent bleeding after the procedure is over.
Sounds like good work.
Thank you.
Thank you for sharing.
Thank you.